Hello, everyone, and welcome back to VIDA News Live. I am Senior Correspondent and host Dom Garret, and I am so happy to have you joining us today for this panel discussion on the report from the Global State of Tobacco Harm Reduction. As you may know, on November 4th, that saw the launch of Burning Issues, which is the Global State of Tobacco Harm Reduction 2020. It is the latest benchmark report from the, let's see, I have the exact words, the UK-based Public Health Agency Knowledge Action Change. We are lucky enough today to be able to be joined by three of the brains behind this report, behind the data that went into it, the dissemination of that, the spreading of that message far and wide. And we're going to host a conversation today where we are able to dive a little bit deeper into that, sort of see what the goals of this report are, as well as discuss the obstacles that currently face tobacco harm reduction. And so I am so glad to right now welcome in our panelists. We have Professor Gerry Stimson, who is the project director of the Global State of Tobacco Harm Reduction. We also Gerry, Harry, Ruth, thank you so much for joining us today.
You're welcome.
Wonderful. So this report, the Global State of Tobacco Harm Reduction Report, this is a fantastic document. I really encourage everyone out there to make sure to read it if you have not already. But Gerry, I would love to ask you first, if you could just give a little bit of an overview of the report, and if perhaps you and Harry might be able to talk a little bit about why it is important to have this report right now.
Okay, thanks, Don. Thanks for having us on. We are only three of a larger team, and the Global State Project is the report, but it's other things as well. There's a website, there are meetings, and it's all designed to, what in my terminology is a bit fancy, it's about creating a conducive environment for tobacco harm reduction. It's all about alerting people to how harm reduction for tobacco is developing globally and what more needs to be done. Just a bit of a backstory. I had a history in HIV prevention, mainly around people who inject drugs. And many years ago, I started a document called the Global State of Harm Reduction, which mapped the uptake of methadone, needle exchange, and so on globally. And we sort of imported that idea to say, well, what's happening with tobacco harm reduction? What progress is there? What are countries doing in terms of regulation? What do we know about the extent of the use of different tobacco harm reduction projects? And really to map the use and the uptake, I suppose optimistically saying that doing it from the first year we did it, 2018, then 2020, then 2022 and onwards, we'd like to see a kind of an upward trajectory. But as we discussed today, it's not been a smooth road, and it's not, you know, we were very optimistic in 2018, but a lot of bad things have happened in the last 2 years. So we're mapping the good and the bad things. And the first report we did, which Harry wrote, was called No Fire, No Smoke. This one's called Burning Issues. And I think that kind of sums it up. Tobacco, when burnt, is a dirty nicotine delivery system. And so this is about harm reduction and how harm reduction should be easy. There are a lot of people out there who are making it not easy. So that's kind of where it started.
Yeah. And you know, your report, you know, has the 8 million smoking related deaths a year. You know, that really is such a, I mean, it is, I mean, you say it right here, it's a colossal failure when it comes to public health. And Harry, I was wondering if you might be able to just add a little bit more color to what Gerry said. You know, when in looking at this report, I mean, were you surprised to see how big of a failure this has been from a public health context?
Well, like you say, we've got 8 million smokers dying from smoking-related diseases every year. The WHO's own estimate is that by the end of the century, we've got 1 billion going to lose their life to smoking. And you have to set that against a context of the Framework Convention on Tobacco Control and the WHO's own strategy for dealing with this. These estimates haven't changed from the WHO, which shows that the attempt to reduce levels of death and disease from smoking really haven't worked at all. I mean, all sorts of interventions have been, taxation and smoking bans and all of that kind of stuff. But the weakest bit of the WHO strategy is the bit that talks about offering help to smokers to quit. The bit that actually makes a difference to those figures, they can't deliver on. And they can't deliver on it because it's the most expensive bit of the strategy. And 80% of the world's smokers are in the poorest countries, in lower middle income countries, where they, first of all, don't necessarily have the health systems and the infrastructures to deliver what's required. At the same time as these countries are also tackling public health issues, which I suspect are of far more concern. Infectious diseases, malaria, Ebola, all kinds of infectious diseases, particularly in Africa, and now, of course, COVID on top of everything else. So these are not necessarily priority areas. And what tobacco harm reduction promises, and interestingly, at little or no cost to government, because public health interventions are very expensive to eradicate smallpox and deal with malaria. These are not small amounts of money we're talking about.
Yeah.
Tobacco harm reduction offers, and if you like, a third way. I mean, it's not that we disagree with all the other interventions that are there, but they clearly are not working or not working well enough. Tobacco harm reduction offers this third way, because otherwise, all that's really being offered to most of the world's smokers is you either quit or you die.
Yeah, and I find that so interesting because it seems like from the WHO, what we see from the FCTC, and then also what we see with organizations like the Union saying that I find it interesting. You talk about 80% of those that smoke in the world are from low and middle income countries, and yet prohibition seems to be the only option or the only solution that is being put forward. What is it about tobacco harm reduction that seems to be so difficult for people to grasp when it seems like other harm reduction, as we talked about for HIV and AIDS, other harm reductions when it comes to drug use seems to be more widely accepted? Like, I know that's a large question, but what do you think it is about this specific thing that makes it so difficult?
I think what it boils, the main problem, if you like, is big tobacco. This is the quite obvious elephant in the room, really. And of course, the WHO are pretty slow off the mark in accepting the idea of drug harm reduction on the basis it was just encouraging people to use drugs by offering them, needles and syringes and methadone. So that took a while to get acceptance. But I think, see, public health has a problem when it moves from communicable to non-communicable disease control. Because then you start morphing away from, like I say, infectious diseases, which is not exactly controversial. You want to wipe those out and save millions of lives. When it goes into public health, lifestyle choices, obesity, all the rest of it, it's very easy for public health to shift from a public health perspective to something that's a little bit more morally driven.
Yeah.
And I think that's what's kind of happened in this particular case, bearing in mind that smoking rates amongst adults and young people in higher income countries have begun to fall over the last several years, have fallen quite dramatically.
Yes.
And that leaves a bit of a hole in the mission statements of quite a lot of anti-tobacco organizations. So the goalposts have shifted somewhat, and they've shifted towards what we call in the report a war against nicotine.
Yeah.
So not so much as still a war against tobacco, but a war against nicotine. And where that leads you to is the whole debate about addiction.
Yes.
And the point about addiction is, of course, when you use a word like addiction, it comes freighted with all the kind of mayhem and chaos that the public associate with people who've got problems with crack or heroin or crystal meth. The thing about nicotine from a purely scientific and clinical point of view is it's actually relatively harmless. I mean, unless you've got some serious heart problems, in which case you shouldn't be drinking coffee either. There really is that you can say that's detrimental about regular nicotine use. I mean, after all, nicotine is in nicotine replacement therapy. Patches, gums, lozenges, etc. So the goalposts have shifted now, and it's become this idea, particularly when linked to young people, which is another one of these kind of red herrings, which we can kind of talk about. There's been a lot of experimentation with vaping about, as you would expect, young people experiment with all sorts of things, but their regular take-up is very low compared to the real problem, which is trying to get adult smokers to switch away. But from my point of view, and alongside Gerry, my background really is in non-medical, recreational, illegal drug use. Addiction to me is a habit plus harm. That's addiction, or dependency, if you prefer. If you take out the harm, which you pretty can much, what you're left with is a habit. You're left with a habit. You're not left with, the chaos of addiction. But that's become the trope. That's become the narrative, linked to the fact that apparently big tobacco are trying to get all these kids hooked on nicotine in order to compensate for falling cigarette rates, of which there actually is no evidence whatsoever. So it's not straightforward. It's quite you've got to start trying to tease all of this out. And I've probably garbled through it at a rate of knots.
No, I mean,
but nevertheless, that's kind of that's really the landscape that we're trying to tackle in an evidence-based way, when what you're actually dealing with is a belief system. And it's the belief system that it's big tobacco that's behind all of this, and it's all awful and terrible. And it's really hard to argue against a belief system, however much evidence you've got. We have to keep trying. We've got to keep going with this. Certainly. But that's the conflict. That's the conflict.
And there's a lot of that there. I mean, I think that we all can understand that. If you're paying attention to whether it's the world of tobacco harm reduction, here in the States, it's obviously a very political system. You talk about people being on different sides of different issues. It's a difficult thing to explain nuance and to sit in that. But I really wanted to ask you, Ruth, as we're looking at the communication of this report, the landscape of people struggling and kind of planting flags in black and white versus like finding that gray area and the nuance. Can you talk a little bit about like the communication, the reach of this report, and some of the challenges that you've seen with being able to take this wonderful package of data and actually be able to make it worthwhile and meaningful to people that are actually on the ground?
Sure. I mean, the issue of nuance in communicating around tobacco harm reduction, it really is a major challenge. There are such few spaces for nuance, despite the fact that really we need to be building alliances, we need to be building and opening dialogues around the end goal, which should be the same for everybody involved in this debate, and that's to bring about an end to smoking. It's highly politicized, it's highly emotive, as Harry's just referred to. For a lot of people, it seems to form around a belief system. We have contested science, we have strong feelings on all sides, and as a communications specialist, that makes my job quite hard sometimes, because actually what people need is good quality information, and that's one of the things that the Global State Report Series aims to provide. We provide good quality information about the state of tobacco harm reduction, and we provide access to data through our website. I know that Gerry is going to talk in a moment or two about the data and how we developed a particular figure for this report, which is a first, a world first, because data is important. We need the facts, and without access to good quality data, people can't form the arguments that they need to form. They can't spread good quality information to others. We can't get the message out. So in terms of what we offer for this audience who are watching today, we are really hopeful that you will come to our website, which is GSTHR.org, and use it as a tool. So from the website, you can download the report. The report executive summary will be translated into 12 languages in addition to English. We're also able to provide you with an active and dynamic data tool. So you can access information on smoking, on safer nicotine product use, availability, the legal status across 200 countries. And you can draw comparisons, you can build charts, you can make a regional comparison chart. So there's plenty of stuff that is there for you to use when you are doing your work in research, when you are doing your work sort of supporting policymakers perhaps, or simply when you are investigating this subject for yourselves. So I wonder if we could maybe ask Gerry to talk a little bit about our groundbreaking world figure that we unveiled on the 4th of November and how we got to it, just as a way to demonstrate some of the work that's been going on sort of behind the scenes to really form the Burning Issues report.
Yeah, I would love for Gerry to jump in really quick, though. I do have to say I absolutely love the website and the comparison tool that you have there. You know, we've been doing so much work here at VIDA, VIDA News, not just here and not just like in high income countries where there seems to be more data that is available or just readily accessible when it comes to having things like resources and money for a lot of these countries, and the ability to be able to have comparisons, to be able to go country by country and sort of just get a sense of what the landscape is. That is so important because, you know, I often hear us, you know, we've done reports and we've done panel discussions about low and middle income countries. You know, we did an entire series about that. But, you know, these countries, even inside of the same continent, you know, they're not a monolith. They are not the same. And being able to see what the differences are, give you that clearer picture of actually being able to solve what the problem actually is. And, you know, to be able to have that initial set, it's so powerful. So thank you to your team for doing that work. And I would love, Gerry, for you to talk a little bit about that process and about, you know, those figures that you, the groundbreaking work that you guys were able to do.
Yeah, thanks, Dom. I mean, it's a bit odd that we're having to do the groundbreaking work when there are so many scientists out there who should be calculating these numbers and looking at the data and the evidence. And given the international interest and for many the concern about safer nicotine products, why aren't people out there measuring how many people are using and what are the trends? The backdrop is the 1.1 billion smokers, which WHO estimates globally. And that figure has remained unchanged since the year 2000, and it's not predicted to change for another 5 or 10 years. So set against the 1.1 billion smokers, just how many vapors, how many snus users, how many users of heated tobacco products are there, and what are the trends? Now, it's kind of still early days because many of these products have only been around for around 10 years, different of course of snus and other smokeless products, but the new products have only been around about 10 years. So can we get a handle on how many people globally are using a vaping or are using snus or heated tobacco products? That's difficult because there are not a lot of surveys. I think we found about 50 countries which had reasonable surveys of vaping, and many of those have not been repeated. So many of those were done around 2018 and not been updated. So we had to use a little bit of taking as a base the countries where there was information. We had to use a little bit of trickery to look at market trends and see how we might amplify what we know about the number of vapers in 18 and now take it forward to 2020. Question then arises of, well, what about all those other countries where we know there are people vaping or using IQOS or heated tobacco products or snus, for which we don't have information. So what we do is we do a little bit of epidemiological magic where we sort of argue that adjacent countries are likely to have similar levels, and that's often used when we're trying to measure health problems globally. If you don't have good data for one country, you look at other countries of similar economic condition, similar social condition, and you kind of do a bit of extrapolation from one to the other. So at the end of all that, we come up with the estimate that there are 68 million vapers globally, our best estimate. And that kind of accords with market estimates from 2 or 3 years back, a growth from estimates a couple of years back of 50 million. And then looking at information from manufacturers, our heated tobacco product estimate is around 20 million and around another 8 to 10 million for users of US smokeless and snus type products. So it gives you around 100 million users of safer nicotine products globally. So that kind of looks good, starting from relatively little. 10 years ago, 68 million vapers sounds good, but it's not good when you look at the number of smokers there are. It's only 9 users of safer nicotine products for every 100 smokers. So doing well, but we could do a lot better. It's not all doom and gloom. I mean, we should be moving faster on this, but if you look back over to the last disruptive innovation, which was the rolled cigarette, Bonsack invented the cigarette rolling machine in the 1880s, and it took about 60 years for the rolled cigarette, the manufactured cigarette, to drive out other ways of smoking tobacco. So these changes can take a long time, but we can't really wait 60 years for non-combustible products to drive out the cigarette.
No, yes, that would be far too many unnecessary deaths in that time frame. So I guess one question that I had as you're looking at this, I mean, was there anything, obviously these numbers are groundbreaking, as you said, and it's these estimates have not been there before. Was there anything that particularly surprised you as you really dug into the data and started to see these trends?
Well, yes and no. I mean, there are good stories. I mean, there are countries which are mapping uptake of safer nicotine products and doing it well, and where we're getting some good case studies of quite dramatic changes in smoking and the use of safer nicotine products. I mean, Japan, we looked at the data on cigarette sales and on heated tobacco product sales in Japan, and since the introduction of heated tobacco products, there's been a 32% drop in the sales of cigarettes in Japan. That's unknown. It's never been like that for other interventions. Norway, only 1% of young women smoke. About 14 or 15% use snus, and 10 years ago 14-15% of them would be smoking, but smoking has virtually disappeared amongst young women in Norway. UK, continued drops in prevalence of smoking, continued rise in e-cigarette use. So there are a lot of good stories there, and there are probably more good stories if only we could map them. Yeah,
I like that you do bring up both Japan and snus as well when you're looking at Norway. It reminds me of Clive Bates, who obviously was a presenter, a panelist at the conference 2 weeks ago. We've had him on our program talking about how the duty of curiosity that public health officials around the world should have when looking at numbers like that, because this is something that that there can be options there. Now, obviously, we're talking about some of those countries. I was wondering if if we could talk a little bit about, shift the focus a little bit to talk about low and middle income countries, because that obviously is, it's important to us here at VIDA News. I know that it is important to you all as well. And Harry, if perhaps you can give a little bit of color of what you've seen, especially as we're thinking about these philanthropic organizations, the big NGOs that seem to be pushing these anti-SNP policies. Can you talk a little bit about that and what you think we should do moving forward, how those countries can actually be able to decrease their smoking rates as well?
Well, part of the problem here is that, as I said earlier, these countries don't necessarily have the health infrastructures to move things forward in the way that's best for the smoking population. And what has happened is that there are basically US funded so-called from philanthropic organizations, and I use that term kind of a bit advisedly in this particular context. They are encouraging grantees of these organizations are trying to encourage lower and middle income countries not to really examine the evidence themselves, take their own decisions as fits their internal conditions, and just ban everything. And this is quite blatant, really. They're saying, well, you really haven't got the time, energy, or finances, or structures, or expertise, or whatever it is to make any decisions about e-cigarettes or smokeless or any of that. The best thing you can do is just ban everything, with the little caveat that if it turns out they're not too bad, really, then maybe you could consider controlling them as tobacco products, which equally makes no sense whatsoever. So that's the kind of direction of travel that they're trying to push these countries in. Which, and of course, what is interesting is, of course, that the biggest tobacco companies in the world are the companies in China and India, who are obviously very influential in the region, and I have to say, have every commercial interest in making sure that safer nicotine products really don't gain traction. So that's that they face. Like I said, 80% of the smokers are there. The other issue, I think, particularly in countries like India and Southeast Asia, the conversation tends to revolve entirely around kind of vaping and e-cigarettes and all the rest of it. But large numbers of tobacco consumers in those countries don't use traditional, conventional, mainstream cigarettes. They use their own oral products and their own versions of local cigarettes, which are highly damaging. I mean, some of the highest rates of oral cancers in India are caused by the use of oral tobacco products. So what needs to happen in some of the countries is that the governments need to consider how do you actually tackle this? These products that are, so it's no good trying to necessarily sell, heavily market e-cigarettes in India, for example, because probably the affected population will find these unacceptable, not culturally and socially appropriate. So there has to be an element of nuance here. The companies have to step up in terms of trying to make these products available. But of course, tragedy, not just for LMIC countries, but for people, and if you look across what we call in the report the left behind, indigenous populations, people with serious mental health problems, drug and alcohol problems, their smoking rates right across the world high compared to in most countries, 60, 70, 80%. Same for people who are prisoners and offenders. the tragedy of trying to undermine tobacco harm reduction is ultimately all you're doing is you're shoring up the profits of the very companies that you're trying to legislate of existence, which is of course nonsense. I mean, we, through our contacts, we reckon that probably have only got about 20% of the, just on the vaping side of it, of the vaping market across the world. And to be perfectly honest, if the drive towards complete and total ban, these companies who are already making millions, billions actually, from selling cigarettes, will literally just shrug their shoulders and walk away. Like I say, at the same time, preserving tobacco in major LMIC countries who also have a seat at the table around the parties, which is the meeting place for member countries for the SCTC, which always strikes me as incredibly ironic and a massive conflict of interest, which seems to kind of conveniently slip under the radar when people talk about conflicts of interest. So that's really where so much of the effort needs to lie. But like I say, I think it is a global issue. It isn't primarily LMIC countries are the countries where a lot of the attention needs to be focused with the right products at the right price to the right groups of people. But it is a global issue for people in those situations all over the world.
Yeah, and I find it interesting that you do talk about the state ownership of a lot of those tobacco companies. I recently had the opportunity to sit down with Professor Daniel Milan, who is a business ethics professor, and actually just put out a report called the Conflicts and Contradictions Report, where he dives into these countries that have signed on to the FCTC. And how many of them own 100% of tobacco companies, and how they are the ones that are allowed in, as you said, inside of the room at the table, while a lot of other people have actually been shut out. I mean, that's actually part of the origin of VIDA News. Realizing that this information needed to actually be able to be shared, and people needed to have access to it, and unfortunately, that is being restricted. Gerry, I would love to get some of your... Oh, Ruth, yeah, go ahead.
I was just going to say, including consumers and affected populations are entirely excluded from that decision-making process, which is entirely unfair, because they are the populations who are living through the consequences, and so they need to have a voice. And I think it's the same. It's picking up on the kind of same issue that Harry was referring to in terms of low and middle income countries. Solutions need to be found that are appropriate for the individual. And there's a whole rate. There's always going to be a range of people need a range of options to be able to make the choice that suits them. And they also need that opportunity to feed into decisions that affect them. The phrase "nothing about us without us" resonates just as much in tobacco harm reduction as it does in any other area of public health.
Yeah.
Sorry, you're going to Gerry.
And I think there's another irony here, because if you look at all the international public health treaties which the WHO are signed up to, they all talk about empowerment. They all talk about people having the right to make their own decisions about their own health. And in this cinema, they're absolutely not. They've just been denied access to safer products, which is pretty despicable when you think about it.
Yeah, it's I would say it's a head scratcher, but it's more a fish shaker when you really think about it. How frustrating that is. I guess Gerry, what are your thoughts on that? I know that we've touched on a lot of this. I'd love to sort of get you in on this as well.
Yeah, part of it, I think, coming back to why are people in tobacco control and in public health so scared of this? It confuses me, because I've got a lot of colleagues in public health who are very pro drugs harm reduction, pro drug policy reform. When it comes to this area, they're sort of they're scared of it. Firstly, I think it's because they feel it undermines the whole big project for driving out smoking and driving out the tobacco industry. But also, I think rather, there's a question of ownership. That it wasn't invented by them, and unfortunately all they can really do is to sort of sow fear, uncertainty and doubt, because what's driving this is consumer choice. Nobody told these people to vape or to use snus. No government, I mean, even the UK government, now does support it, but it's slow on getting in on the act. All this has been driven by consumers putting their hand in their pocket and choosing to vape or choosing to use snus rather than to smoke. It's driven by consumers, and it's driven by good products. So this is, as I often say, this is public health with a small p and a small h, but it's not being done by capital P, capital H, public health. In fact, public health's got very little role. You don't have to spend money on this. It can all motor on very well if only you take off, the brakes, or don't try to put the brakes on. So it's about having the right regulatory environment, and for public health and tobacco control, it's either sort of saying, don't say anything, but if you say something, be supportive, because people are making good decisions. And what could be better, because it is mainstream public health, that people have kind of taken responsibility for changing their behavior in order to avoid early death or to avoid disease. I mean, it's perfect public health, but a lot of people in public health just don't get it. So I think I'll be saying that to my grave. Why didn't you all join in on this project? But it's we'll get there. I mean, it took a long time, as Harry said, for WHO to accept drugs harm reduction. We'll get there. And in fact, at the moment, there are bans, but bans are not the most common way that countries are dealing with this. The most common way is to regulate. Far more countries regulate than ban, and that's what we've got to push forward. Sensible regulation, give consumers confidence, give the public confidence that these are legitimate consumer products for a legitimate drug.
Yeah, and I mean that comment, that the desire from consumers for that sensible regulation. I mean, I've heard that echoed from the protests outside of the White House for the PMTA, to advocates in Colombia that were gathering from all across Ibero-America, to the doctors and the consumers that we speak to in India, to our friends in Australia that are currently in all sorts of a quagmire when it comes to their government. It seems like everybody is asking for that same thing of just sensibly regulate this. Like, let your ego get out of the way and let us just try to figure that out. So, I mean, Ruth, from a perspective of like, I guess, of messaging that, and consumers actually doing that, I mean, how do you see this report as being a way of sort of being able to help push that message forward?
I think it provides a significant amount of information and evidence to people, and as I said earlier, this is an issue where emotions get raised across both sides, all sides of the debate. And actually, the emotion, if you remove the emotion from it, you need evidence and you need facts. And I think that Burning Issues and the Global State Project as a whole, it aims to provide that. It aims to provide good resources. We want to reach people who are advocating for the right to switch away from smoking and improve their health. We want to provide that information for journalists who are writing about these issues. We want to provide this information for policymakers who are making decisions about these things. So the aim is that this is a resource for people to use, and we hope that you find that the report is an enjoyable read, because I think it is, and Harry is very humble, but I think he would agree with that he's made sure that it's an enjoyable read, and the website is easy to use because our team are extremely technically gifted and have given lots of tools for you to be able to access the website in a way that is user-friendly. So yes, I would just encourage people to go have a look, have a read, have a play with the website, and download the report And if you prefer to read it in hard copy, you can access a free copy for yourself as well by going to the website. So. Yeah,
I've personally printed up. I have a bunch of different pages here. I've highlighted plenty. It's a massive undertaking that this entire team has, and so many, as Gerry, you said, that are not able to join us on this broadcast have put into this. I guess, Harry, I'll ask you this. As the executive director of this, executive editor, I should say, of this report. I guess for you, what does success look like from the work that you've done here?
Gosh, well, I suppose I would say I'm hoping that when we get to Global State of Tobacco Harm Reduction 2022, that we can map some real progress. I mean, there are some little beacons of light. I mean, I think the fact that the FDA have recognized industry science in relationship to snus and a heated tobacco product that is allowed to promote themselves as safer nicotine products. Bearing in mind the USA, WHO notwithstanding, the USA is a bit of a leader in this. I mean, they've led the world with the bad news. About lung-related deaths and more risk from COVID and all the rest of it. So I'm hoping that we can have more beacons of light like that from the States that will allow us to report more positively that we have, as Gerry said, a sensible, regulated consumer market, and not one driven by distortions, propaganda, lies, however you want to describe it. So that's, and hopefully this report is, it's a step along the way. There's about 300 references in it, and there for people to check out the evidence for themselves if they feel so inclined. So that's it. I mean, that's people need material on this that is topical, non-judgmental and evidence-based, and hopefully that's what the report delivers.
Wonderful. So I think we are just about reaching the end of our time here, but I wanted to give Gerry and Ruth and Harry, if there's anything else that you would really like for our audience to be able to know, either about the report, what you hope that they do with the report, or what your any other thoughts you may have on how we can, a lot of our audience here wants to continue to see this good work being done and to continue to see sensible, pragmatic solutions. So do Ruth, Gerry have any additional thoughts on that?
Gerry, I give the floor to you.
Well, you said, what would success look like? Well, I think, no more bans. And second, the biannual meeting of countries, the Framework Convention of Tobacco Control, the Conference of Parties, has neglected one of the three pillars of what they call tobacco control. They refer to demand reduction, supply reduction, and harm reduction. It's there in the international convention. So success for me would be countries coming forward at the Conference of Parties, at the FCTC biannual meeting, and say, hey, why are there three things here and we only deal with demand reduction and supply reduction? And how come we've conveniently forgotten harm reduction? And start to think what harm reduction might look like. So that would be success if that discussion at that international level begins to change. But there are lots of other indicators of success: more people using, more people switching, more people having a happier, healthy life, but still using nicotine if they want to.
Yeah,
we'll see.
And we have that benchmark number, right? Like the work that you did of that, having that 9
yes.
9 in 100.
Will it go up?
I feel like we have a little thermometer on the wall where we could raise it up as we start to see that. So yeah, that's wonderful. All right. Well, I thank you three for joining us. If you have any questions for this crew, Ruth, how can everybody best be able to continue to interact with the report outside of just on the website?
Sure. So website at GSTHR.org, also on Twitter at Global State THR. That's Global State THR. So jump on and follow us there, and you'll get all our latest updates, and you can interact with us as well.
Wonderful. And I will say, keep an eye on our social channels, VIDA.news. We will be taking some extra different pieces of this, going to be sharing that out as well. And we do have another panel that is going to be coming to you probably in early December, where we're going to take a lot of the information, what we have here, and actually really try to think, country to country, especially in LMICs, how this information can be applied, what are the different ways that it can be used. We will have some fantastic panelists that are actually on the ground, some of which spoke at the conference for the GSTHR, and we're very excited to be able to bring that to you. So Harry, Gerry, Ruth, thank you so much for joining us today. All right. Thank you again to everybody. If you have any questions,